So I've just been talking about deep brain stimulation, and in doing that we've looked at what deep brain stimulation is, and also when best to refer patients and how to do that, and discuss the funding issue. So now that we have NHS England, deep brain stimulation is equally available to all patients, so we don't have that red tape anymore. We looked at the symptoms that will respond to deep brain stimulation, so the motor symptoms, tremor, rigidity, bradykinesia, gait difficulties, and those symptoms that won't. We also looking at when to refer patients at the early STIM study, so the idea of referring patients earlier in the course of their Parkinson's for deep brain stimulation, like we're also looking at with other advanced treatments such as apomorphine. It's good to be able to show the delegates some videos of patients who are on and off stimulation, so as they can see the effects for themselves. It's also important, I feel, to discuss the follow-up care and the management longer term of these patients, so as the delegates that are attending know what we're doing with the medication and the programming. It might be that they don't really need to understand fully the nature of the programming because they're not doing it. It's done by the nurses at the specialist centre, but at least as the patients then subsequently describing to them later on down the road when they have their own patient with DBS, they're familiar with that concept.